Kids are back in school this week, and that's where we're going to begin with the tough choices facing parents these days. COVID cases among America's children are surging to all-time highs. More than 252,000 kids tested positive for COVID-19 in the last week alone. Think about that for a second, because that's the highest total ever in a 7-day stretch, according to the American Academy of Pediatrics. The Academy says that children accounted for more than 26% of all COVID cases in the U.S. in that week alone. Now, this is sure to be very alarming news for parents as millions of kids head back to the classroom. And fights between the parents are breaking out in states like Florida and Texas over safety measures. Mireya Villarreal is in San Antonio, where COVID outbreaks are already affecting the school year there. Mireya, good morning to you.
Hey, good morning, Gayle. Here in Texas, less than 60% of the eligible population is actually vaccinated, and that is with pediatric cases surging and the Delta variant spreading very quickly. Here's what we know. More than 50,000 students tested positive inside Texas schools in the last 3 weeks. That is leaving parents very concerned by what they say is a lack of transparency from school district officials.
I just want peace of mind when it comes to my child and their safety and their education.
For Lindsay Harrison, sending her 3 kids back to school has been a source of anxiety and stress. Her oldest child is immunocompromised in a district where masks are not mandatory. And in the first 8 days of school, 250 notices of positive infections like this one have been sent to families. But Harrison says they're missing key information about who is sick, like at her 3rd grader's school, Kinder Ranch Elementary.
Why can't we know every time a Kinder Ranch affiliated person is testing positive for COVID, whether it's a sub, whether it's a teacher, whether it's administration, or if it's a student?
According to the Texas Tribune, at least 45 school districts across the state have suspended in-person learning following spikes in infections. The Lone Star State recording a record in pediatric hospitalizations over the weekend. Dr. Norm Christopher is the chief medical officer of the Children's Hospital of San Antonio.
There is no doubt that the frequency at which children are being infected is dramatically increased.
And their symptoms are greater as well.
The number of children requiring hospitalization is higher, and the number of kids requiring intensive care monitoring and treatment is higher now than it was during the first or the second surge.
And even with cases surging, Texas is not allowing school districts to offer virtual learning for public school students, which has parents like Harrison feeling powerless, especially when the scope of some outbreaks is unclear.
If we can't be transparent in that information, then what sort of normal are we getting back to?
We did reach out to Kamal ISD. They did not want to talk to us on camera, but sent us a statement saying in part that when somebody tests positive, student or staff member, they do send home a letter to parents on that same day. And if parents believe that their child was in close contact with that person, they can ask for an excused absence. They also clarify that they do give out information about the grade level of the sick person, but by law, they can't give out any identifying information. And that is what is confusing and concerning to parents. Tony?
Boy, Mireya, 50,000 cases in that state alone. That's a lot of rolls of the dice. Thank you very much.